Is this on okay?
Can I get your attention?
All right.
All right, so I have the pleasure of introducing our next keynote speaker, Dr. Marco Angulo. Dr. Angulo was born in East Los Angeles and raised in Southern California. Barely graduating from high school, he pursued a music career as a lead guitarist in a rock band. At the age of 26, he enrolled back in school at East Los Angeles Community College, known as ELAC, where he was an active member in Chicanos Latinos for Community Medicine, CCM. He then transferred to UC Berkeley in 1989 to pursue a BA in Chicano Studies and graduated in 2002. And after graduating, Marco worked for 4 years in the Biology Scholars Program and co-developed the pre-health pathway component in BSP to increase the number of undergraduate students serving the underserved communities as future professionals. He then later attended UC Irvine School of Medicine for the Prime-LC program, which is focused on the Latino community. And right now, he serves as a family medicine faculty and director of the Office of Medical Education Diversity, Inclusion, and Community Service at UC Irvine. So please join me in welcoming Dr. Angulo.
Thank you. Welcome. Oh, wow. So I wanted to thank you for having me here today. And I think Junior asked me, he's like, are you nervous? I go, of course I'm nervous. I mean, this is, look at the room's packed. I just kind of wanted to see who my audience, how many of you are undergraduate students here? Oh, it's undergraduate, pre-med, right? High school students? Oh, look at that. Awesome. Medical students? Awesome. Physicians? All right. What? Future physicians? Okay, so then the next question is, how many of you want to serve the underserved community? Oh, that's awesome. I'm in the right crowd. Here we go. This is awesome. So I wanted to go ahead and you heard a little bit about my story. I wanted to go ahead and share a little bit about my story. And I also wanted to go over this because right now we're at a deficit of healthcare providers, MDs, DOs, PAs, NPs, RNs, and it's getting pretty bad, and I'll give you some numbers a little bit later on, but I wanted to see if this is a good fit for you, if this is something that you really want to dive into. I could tell you the truth, when I was 25, I wasn't even thinking about doing anything like this in my life, and I'll be honest with you, I'm in a meeting now, and it's a meeting with one of the deans or the dean's panel or whatever. You get little loqueras. You know what loqueras are? Like, oh my God. Like somebody, bypassed and kept on letting me go, so. But, and then you realize, like, no, it's important that I'm here. It's important what I'm doing, but you do get like the little this is awesome, right? So this is something for you, just if we could just kind of bear with me, just I'm going to read this out to you, okay? Healthcare providers wanted, and this is a wanted list. Must have self-confidence, must be knowledgeable and willing to be a lifelong learner. The number one quality in a healthcare provider, this is what people look for in a physician. As a physician, nurse practitioner, PA, it reassures them. It makes them feel like there's somebody that has their back. Somebody knows what they're doing. Must be extremely intelligent, a master problem solver. Being comfortable with not knowing all the answers, but being able to put things together. Must be a hard worker. That goes without saying. Must have a lifelong love for biology. Must have a fascination for science. It's our bread and butter. It's something that we do. We'll do for the rest of our lives. Must be an excellent test taker. You will be inundated with exams from now until the end of time. And starting with all your exams that you're taking now, the little exam called the MCAT, you guys remember that one? Your board, step 1, step 2, step 3, your also afterward your board certifications. So you have to know where to press the ABC correctly, right? Must have a steady hand. You may be a brain surgeon, and with one nick, you actually erase the memory of a patient, right? I mean, it could happen, yeah? Or you're putting on a suture of a 5-year-old because they cut their above their eye, and you want to make sure that that suture, your work never gets seen. So you have to have a steady hand to make sure that things heal well. Must be have strong leadership skills. You will automatically be looked upon as the leader. Doesn't matter what it is. Anything that goes on, okay, let's ask the doctor. For some reason, that's the go-to. Must be honest and forthright. Tell it to me straight, doc. That's what you're going to hear. Tell it to me straight. Tell me what I got. You have to know how to strike that tone and break down things that patients really understand and how to do that. Must be professional at all times. So it's not a 9-to-5 job. What you're getting into is not a 9-to-5 job. I'll give you an example. You're going to Hawaii. On your mind is Mai Tais, right? You're going to be on the beach, and somebody overhead says, is there a doctor? Is there a nurse practitioner? Is there a P on the plane? You're not going to be like, oh, I'm off duty right now. You actually have to go. Like, yes, that's me. Must be altruistic, selfless. That goes without saying. Must be empathetic, caring, and compassionate. Have the ability to validate someone's feelings, someone's suffering, putting yourself in their shoes all the time, and helping to do the same about it, something about it. Must have the ability to work in teams. Must be excellent at collaborative and cooperative work. Must be humble, knowing you are not God. You are not God. Knowing that you can learn from your patients, your nurses, your medical assistants, and not shutting them out because you're the doctor, or you're the nurse practitioner, or you're the healthcare provider. Must have humility, being the first to admit your mistakes. I think is one of the most important things. Must be passionate about patient care and the health field. This is why we're here. This is why we get up in the morning, right? Must have an excellent communication skills. Be a great teacher. Break down all this complex jargon. You're gonna have this patient and you're not gonna go into this biochemistry mode with a patient that, has maybe a 6th grade level education, right? Make sure they understand. Make sure that they repeat. Did you understand? Can we go over this again? Must have strong listening skills. Must be observant. At times, silence is golden. You just listen. Just listen. Unbiased and non-judgmental. At times, you're going to be put into a situation where the belief system of your patient is not your belief system. Putting the patient first at all times. Extreme integrity and high moral standards. Energetic and enthusiastic. Warm and friendly. Love for people. It's contagious, let me tell you. In clinic, when you're around and you're, you enjoy what you do, it spreads to others. Must have humor. It's a long road. And being able to laugh at yourself sometimes, laugh with others, that's one of the most important things. So, with that being said, do you see yourselves here? Do you fit these qualifications? Would you apply to this job? Is it too much? Is it like, ugh, this is daunting? Maybe, possibly. Could you skip the slide? You see yourself here. Must have steady hand. You already have that. Must have the ability to work in a team. You already have that. Must be observant. But maybe, possibly, test-taking skills or MCAT or whatever you're working on. Can I have the next slide? Maybe you're here. Strong leadership skills, honest and forthright, selfless. Next one. Must be passionate about patient care and the health field. Warm, friendly, love for people. Maybe you start there, and that's it. I'm a firm believer that we don't all grow up knowing all of these things. I started somewhere right here. Maybe in fact, I could probably take a couple out here, and that's where I started. And it's something that you learn for the rest of your life. You learn from birth all the way through. And as some of you went to my workshop today, that's the type of physician that you will become. your experiences that have had happened in your life, that's the kind that you reflect. So I'm going to tell you, I mean, you know, you always hear it, inundated with paperwork. Oh my God, you know, don't go into this. Patients you can only see for 10 minutes or 15 minutes. It's your choice. It's your choice. I've made a choice to spend time with my patients. I've made a choice to, you know, I'm probably one of the slowest physicians that you'll ever see, but I enjoy my work. So it's up to you, what you want to do. I want you to know that. So, but if you do want to burn through patients, that's your choice too, you know? So I wanted to tell you a little bit about myself, and then we'll come back to this. I'm just about a high school dropout. So I graduated through the skin of my teeth, and the only reason I graduated from high school was because I promised my dad. My two parents are from Mexico, Guadalajara and DF, and they, shout outs? Yeah. And they wanted me to go to school just to graduate from high school. They said, just give us C's, no big deal, no worries. And I was on the verge of not graduating. And my dad said, please, just graduate. We came to this country for a better life, just do it. So I said, fine. During my graduation of high school, I went to Sure High School in Montebello. Sure High School? Oh, nice. During the graduation, I graduated and I didn't care less. I walked, I took my diploma, it was all like crinkled, and I said, here you go, old man. My dad, I call him old man. Not in an endearing way. Here you go, old man, it's for you, not for me, whatever. And I walked, I said, I'm peace out, I'm out of here. So I ended up, my dad said, if you want to go back to school, you can go to school, use your mind, or you can use your hands. And he goes, you can actually, my dad installed floors. He could install these floors, he's amazing. And I said, I'm going to use my hands. But I didn't go into business with him or help him installing floors. What I did was I became a professional musician. And I actually played in a rock and roll band, had my hair down to here. My nails were painted black, had some eyeliner on, and a cross earring. I still got the scar, by the way, keloid. So I did that for a while, and at the same time, for some reason, wow, I started getting away and apart from my family. And I thought, you know, this is something that I want to pursue. I want to be the next Metallica. I wanted to, you know, and then, I mean, I looked like The Undertaker. You know The Undertaker? So that was, if you could imagine that was what I looked like. And my family was like, well, you know, what are you going to do with your life? I'm like, what is it to you? You know, I'm living my life. And sure enough, you know, they've had enough. I was still living at home, and they said, you need to leave. You need to go. And I said, fine. So I stayed in my studio for my music studio for a while where we practiced. And I ended up actually not having a cent to my name. I remember always looking through the couches and making sure that there was like coins, quarters, whatever. Maybe somebody had slipped a dollar bill there or something like that. So then I came to a realization when one day, and then this El Nino thing always reminds me of this, where it was raining cats and dogs. I mean, it was the El Nino 1997, I think that's when it was. And my car stalled. And I was in the middle of the street and nobody wanted to help me. And believe me, I got out of my car and I had my hair and I was all drenched, wearing black nail polish, everything. And I'm like, could somebody please help me? You know, like, could somebody help me? I can't even imagine what they were like. They were like, "Rah!" Right? So for me, it was like, where's the humanity here? Just push my car, you know? And everybody's like, oh my God, he's gonna kill me, you know? So finally, somebody pushed me up aboard. And I sat there, and I called my friends, and my friends are all like, dude, it's raining. I can't go pick you up, you know? So my last resort, I called my dad. And my dad, he picked me up, and it was the longest drive, which was 10 minutes, the longest drive in the car back to his home. And I was dripping with my long hair and thinking like, oh my God, is this my life? Is this what it's come down to? Is this what it's going to be like for the next 50, 60 years? I don't know. And I was 26 at the time, 25, 26 at the time. So it was a realization that I needed to change my life. At the same time, I had a friend and my brother said, hey, you're a pretty smart guy. Why don't you go back to school? So I was like, well, what else am I going to do? Yeah, sure, I'll go back to school. So I ended up going to East LA Community College. East LA, all right. Go Huskies. And I worked during the day, and I went to school during the night. I was part of this program called The Pace. And I ended up loving it. I was like, oh my God, this is the greatest thing. I'm learning. I didn't know what I was going to do with it, but I was learning. And it just seems like everything kind of fell all together because at that same moment, I met this guy named Yasser Hiron. Do you guys know Yasser Hiron? Some of you? No? So he actually, he was a part of CCM. You know CCM, Chicano for Community Medicine? He's like a little guy, but like a big bullhorn. He's like, come on, join CCM, Chicano for Community Medicine, health disparities, here we go, come on. So I actually went, I said, what's this all about? And he goes, you gotta come to a meeting. I went, not to help the Latino community, I went because he was so vocal about it. I gotta check this out, right? I sat there in one of the lectures, it was a great lecture, and they talked about Latino health. They talked about all the issues going on in our community, and I was like, oh my God, that's my community. That's where I've come from. That's what I'm going through. That's crazy. So I ended up thinking maybe I could possibly go to be a doctor. Maybe I could possibly go to medical school, who knows? So I ended up going through the process and taking like general chemistry, all these courses. And I met up with a pre-med advisor, and her name was Dr. Chan, and I remember she told me, she said, so you're pre-med? I go, yeah. I said, I want to serve the underserved community. I want to go to Latino community. She's like, I don't know. Nobody from East LA College goes to medical school, right? And I ended up leaving that conversation really discouraged. I was like, wow, that was worthless, but okay, I guess I'm not going to go to medical school. So then what I became was a closet pre-med, right? So then a closet pre-med is like you take the courses, but you don't tell anybody that you're a pre-med. Because at the end of the day, you're like, Tom, I'm in medical school, ta-da, you didn't know? Yeah. So I was taking all these courses left and right, like now I was in calculus, now I was in, and that same guy, Yasser Hiron, he's like, wait a second, you're taking all the courses I'm taking, I'm pre-med. I'm all, yeah, and he's like, well, have you thought about being pre-med? I'm like, nah, just taking all this for fun. And he actually said, you know what, I think you are pre-med. And he goes, I want you to write your name on the board, Marco Angulo, MD. Marco Angulo, MD. I'm like, no, I can't do that. He's like, just write on the board. It was chalkboard. We didn't have it's a long time ago. It was chisel. No, I was kidding. And he said, write on the board. I said, no, I have too much respect for that degree to write on the board. It's not possible. So he finally convinced me, and I wrote it on the board, and I looked at it, and I was like, oh my God, this could happen. This is something that's possible. This is something that I can fully achieve. So I took that, and I ran with it. I became a very open pre-med. So I was like, guess what? Everybody, I'm pre-med. Pre-med, pre-med, pre-med. Anything you got, pre-med, I'm here. And it became something that at first it was a backlash, because people were like, oh no. My dad was like, hi, mijo. You barely finished high school. How are you going to be pre-med, right? My mom was the same way. Just don't waste your time anymore, kind of a thing, right? So all the students, around, it's a very competitive kind of environment. Not as competitive in East LA colleges. I learned that it's in Berkeley. But it was something that people were like, wow, I don't know, it's really tough. And they tried to kind of discourage you. So then afterward, you're like, okay, they're like, yeah, that goes that pre-med student. So I started owning it, and I started believing it, and I started radiating it, right? And all of a sudden, everybody's like, yeah, okay, we accept it, right? So then I was like, I don't care if you accept it or not, I'm pre-med, right? So as I went through the process, it's something that was very near and dear to me because I knew what I needed to do. And I started building relationships with people that actually wanted to assist me and help me through that process. And if you come to one of my workshops, I always talk about a coach. Having that person kind of coach you through that process. I've had a lot of coaches in my life that have helped me out a lot. And hopefully, I've given back as well through that process. But later on, I went to Berkeley, and I was like, go Bears, yes. Beat Stanford. No, I'm kidding. and my first semester at Berkeley was a complete disaster. I had no idea what happened. I thought I ruled the town at East LA College. Then I went to Berkeley, and I was like, what? You know, at the front rows, the class starts at 8:10, like 10 minutes later. I'm like, oh, I'll get there like 5 minutes earlier, no problem. I get there, and like there's 3 rows, 4 rows are already filled up. Everybody's got their like clicky pens, and they're ready to go. This is before like everybody had their laptops. And I haven't even got like my books out of my, you know, like the plastic wrap, you know. I was like, okay, what class is this again? You know, I was like, I'm not in that, you know, the same environment as East LA College. And I ended up almost failing my bio class. And I thought, my God, this was a good run. This is, you know, it's okay. You know, it's over, right? A coach, one of the people that I really give a lot of credit to, he said, it's not over. Are you kidding me? You just started. Let's go ahead and get you through that process. And you had a bump in the road. Now let's go ahead and get you up again. You know, but what about this grade? Who cares about it? Done deal. It was already done. What are you going to be doing now? Okay. So then the next class was organic chemistry. Super easy class, right? So that's when I figured out I had lost my mojo. I had lost the reason why I wanted to become a doctor, become a physician. I had felt that I had forgotten why I wanted to do it. I was just trying to survive. I was just trying to survive around the environment. It was a harsh environment. I think I've talked to, it's changed now, right? Everybody's so loving and caring, right? But it's just, it was deeply competitive. And what I had to do was find it again. And the way I found it again, and I started to do reactions, and I started to actually put people's names on them, like Senora Sanchez, this is PCC, oxidizing, you know, physics. This is for Senor Guzman. This is inclined plane, mg cosine theta, mg sine theta, bam, right? And I'm like, that's who I need to get. I need to do this in order to serve this population. I need to get there. So at that point, I was on a different level. It didn't matter what the competition was. It didn't matter where I was going. I knew what I had to do. No, at that point right now, nobody could stop me and intimidate me from what I wanted to do. So I had a great time at Berkeley after that. I finally found why I wanted to do this. And then comes along this wonderful exam called the MCAT. You guys remember the MCAT? Has anybody, who's taken the MCAT? Okay. So there's a small exam you have to take the MCAT. Anyways, to make a long story short with that, the night before the MCAT, I went to 8 o'clock. I remember this. This is, and I put my pens, this was before it was a computer. It was all pencil and paper. No, chisel again. No, it's kidding. Pencil and paper. And I actually went to sleep at 8, and all of a sudden I put my head down, and all of a sudden, what's that? Well, it was my heart, right? And then 9 comes. 10 comes, 11, 12. My wife now, she's asleep. I'm like getting mad at her because she's asleep. 3 o'clock comes, 4 o'clock, and I go, hey, hon, I can't go to sleep. She's like, what? She goes, let's go and get you some NyQuil or something. So driving around Oakland at night at 3 o'clock in the morning, nothing's open at Oakland at 3 o'clock in the morning, trying to get some sleep aid or something like that, and I couldn't find anything. So 6 o'clock came, 7 o'clock came. I woke up, didn't wake up. I mean, I was already awake. Took a shower, went to the place to take the test at Berkeley, because that's where you took it. And I did the verbal reasoning first, and I was like, okay, that was all right. And then the second one was the physics. And the physics part, I was already starting to kind of feel a little hazy, a little like, oh. And then all of a sudden, the question about ducks flying north or south for the winter, and all of a sudden, all the ducks were like kind of waving. And I remember this. I remember that. I was like, wouldn't it be nice to go south? I was thinking like, this is the MCAT, man. Get it together. So it was ridiculous. And I was like, okay. And then the lady says, okay, 5 more minutes. And I'm like, wait, I've got 40 more questions to answer, 5 minutes. So like C, B, C, right? And then I said to her, I go, here you go, I want to go home. She said, you can't go home. You're taking the MCAT. I go, I want to go home. And she's like, you can't. And she's like, you know what, tell me that you're sick. I go, I'm sick. She goes, okay, there you go home, right? And I remember leaving that place, and everybody's at lunch, and I remember my friends were taking the MCAT too, and they're like, hey, come have lunch with us. I'm like, no, I got to go, bye, right? And I remember calling my parents, and I'm like, I'm calling my wife, and she's like, we're both crying. I'm like, oh, it was a good run. Oh, my God. It was horrible, like, yeah, well, who knows? Let's do something else, And then I call my parents, and my parents are like, mijo, come visit us in LA. Don't worry, And then, it was right by, Strawberry Creek. That's where I kind of took that time to, full-on tears. I was adding to the river, And I called, and then my brother picked up the phone, and my brother's like, so what happened? And I'm like, I failed the MCAT. And he goes, so what? Take it over again. I'm like, oh yeah, I could take it over again. Oh my God. Whoa. So I said, I went home, I took 2 weeks off, completely bedridden because I thought my career was over. And then I said, you know what, time to stop the waterworks and everything. Let's do it again. And when I did it again, I felt a lot better. I felt more comfortable because I had already seen that it was a test that I could do. And I took it, and I applied. Now, with the application process, I was going to bring them today. I have 29 rejections from medical school. 29 rejections. And you get them in, they come in quick, right? And we still have them, and I still have them. And I tell my wife, and she's like, just throw them away. And I'm like, well, no, this is important to me. This means that I applied to 32 schools. This means that it took me these 29 rejections, 32 schools to get into one school, So I had chosen to come to Irvine. I got into UC Irvine, and I have to tell you that there's a white coat ceremony that happens. You ever heard of it? They place the white coat. Kelly just went through it for the white coat. It's a very special moment. And I remember my parents being there, and they just could not believe that I was in med school, And I'll be honest with you, 99% of the people that go into med school graduate. So it's not like if it's a attrition rate's huge. It's not. They'll do everything and anything in their power to get you through med school. So in that process, at the end when I graduated, it was one of the most amazing times to hand the diploma to my dad, to my father, which I handed him that crinkled up diploma from high school, to hand him a medical diploma and saying, look, Dad, we did it. And for him to be like, mijo, we did it. And for him to have bought into that, for me, was magic. And the great thing about it now, I'm a faculty member over at Irvine. I have my own clinic, my own patients. It's pretty amazing because you see these patients and you're like, okay, Cynthia's my medical assistant. And I'm all, Cynthia, who do we have? Senora Sanchez, Senor Guzman. For me, it's like, this is it. This is why I've worked this hard to do what I did in order to serve this population. I mean, for me, that has been the ultimate goal. And it's been something that I cherish every day. I love going to work. I'm so excited about it. I gotta tell you though, there is a huge shortage, and I talked about it earlier today. The AAMC, the Association of American Medical Colleges, says that we're going to have a 52,000 provider shortage by the year 2025. And you could see it already in my clinic already being affected. You could see it in the underserved areas because those are the ones being hurt by the most. And it's getting bad. Now, with that being said, you raised your hands. You raised your hands when I said, who wants to serve the underserved? You're up to bat. You're on deck. You're getting ready to go, That's where you come in. And I got to be honest with you. If this is something that you want to do, then it's going to happen. The only person that is going to stop you from doing this, is you. Think about this, though. If not you, then who's going to do this work? If not you, that you're so invested in this, you know what the community's like, you know what we need to do, then who are you going to get to do this work if it's not you? And we make it so difficult. We make it so difficult. We're like, oh, but we have to do this. It's not as difficult as it seems. It's a pretty simple process to go through. Although in our heads, and I was there, I got to do this, letters of rec, oh my God, and it's true though. We get ourselves, and then we're like, well, maybe it wasn't for me, maybe me, And I was talking to Junior, and he was saying something. It's social obligation to do this, right? If this is something that you're passionate about, it's something that we need to really step up and do. And we know how it feels. I know Kelly, she's a first-year medical student. We know how it feels when you wake up in the morning and you look at yourself and you think, oh my God, is this going to happen? Am I wasting my time? Am I putting all this effort, spinning my wheels, and is this going to happen? We know how that feels, right? We know how it feels when you get an exam back and you're like, oh, there goes my career. Or get an MCAT back, and your heart goes from here down to here. And you're like, ugh. It's like somebody punched you in the gut, right? Right? We know how that feels. We know how it feels when somebody says, time's ticking. One of your family members, hey, you're not getting any younger. I need my doctor, Or in fact, we know how it feels when you may not have anybody in your family even pushing you or talking to you about anything. And you're like, well, I'm kind of doing this on my own. We do know how that feels. Or someone here at the conference saying, we need you. Come on, we need you. Come on, everybody to Irvine. And yet, you're like thinking like, I'm here. Why is the bar so high? I'm here. And you're practically out of your skin because you're like, look, right here. Aquí estoy, right? We know how that feels, believe me. And we're here to tell you that you are not alone. You're not alone. There are so many of us that have gone through that process. There are so many of us that are now on the other side that are doing this, that are paving the way. That's why for me it's important to me to be on admissions. I've been on it for 7 years. I interview medical students. I want to advocate. I want to make sure that they're taken care of. I want to make sure that they're being seen by correct eyes, that they're being seen by people that know the community. But I'm going to tell you this, no one's going to give this to you. No one's going to hand it to you. Medical school is not going to say, oh, come on now, You have to take it. You have to take this. How do you take it? You take it by coming to conferences like this, right? You take it by, tonight, opening your books, right? Oh my God, I got to get that extra studying in. I got to make sure, going to office hours. You take it by telling sometimes your friends, you know what? Got to study, got an exam coming up, sorry. You take it by telling your family, I can't make it this weekend. I can't do this, I have to do this. And somebody always said, and I love that, when you set up a plan, a goal without a plan is just a wish, right? So setting up a great plan for you. I really see you guys as my colleagues. I really do. Whenever we talk and sit down and I see, like, oh man, they'd be a great, I already had, Kelly's like, oh, yeah, he'd be great, OB-GYN, ER, so it's just something I do when I see people, because I've seen so much in my life. I've been a pre-med, pre-health advisor for the past 16 years, and now these students are like everywhere, right? And I remember how they were, and to talk to you and to see where you're at, and I always see you as, a medical student, yeah, they would be like this. And so now is the time for you to see yourself like that, if you haven't already. And my message to you, if you haven't written out your name in the degree that you want or in the profession that you want, absolutely start doing that. Start believing in it. Because I see us working together. We definitely need you. We absolutely need you. And my clinic is always going to be open. We're always going to be looking for you. So UCI is always going to be looking for you. There's medical schools that are going to be looking for you. And I wanted to thank you today for letting me share my story with you. And I just wanted to say thank you so much.
like to give Dr. Angulo a round of applause for that very inspirational speech.